Nipple discharge refers to any fluid that leaks from the nipple of the breast. This discharge is considered normal during pregnancy and breastfeeding. However, if it occurs unexpectedly or outside of these periods, it's recommended to see a healthcare provider to have your breasts examined. In men, nipple discharge is unusual and should always be medically evaluated. How does it occur? Nipple discharge may come from one or both nipples. It might be caused by pressing or squeezing the nipple or breast, or it may happen spontaneously, without any physical stimulation. The fluid may be released from one or more milk ducts inside the breast. What does it look like? The discharge can vary in color and texture: milky, clear, yellow, green, brown, gray, or even bloody. The consistency may be sticky and thick or thin and watery. When is it normal? Nipple discharge is a normal part of breast function in these cases during pregnancy and breastfeeding, with hormonal changes linked to the menstrual cycle and in fibrocystic breast changes, which is a common benign condition. Milky discharge may continue for up to a year or more after childbirth or weaning from breastfeeding. Intraductal papilloma. An intraductal papilloma is a benign or non-cancerous tumor found in a milk duct. It may cause bloody discharge, which typically happens spontaneously and comes from one duct only. This type of discharge might go away on its own. Still, a doctor might suggest a mammogram, which is a breast X-ray, or a breast ultrasound. If needed, a breast biopsy will be performed to confirm the papilloma or rule out breast cancer. If a papilloma is confirmed, a surgeon may discuss treatment options with you. When to be concerned? In most cases, nipple discharge is not serious, but it can be a sign of breast cancer, especially when there's a lump in the breast. The discharge is from one breast only. It's bloody or clear, it's spontaneous and persistent, or it comes from a single milk duct. So, let's talk about the possible causes of nipple discharge and when you should seek medical advice. Common causes include abscess, which is an infection, birth control pills, breast cancer, mastitis, a type of breast infection, ductal carcinoma in situ or DCIS, hormonal or endocrine disorders, fibrocystic breast condition, galactorrhea, which is excess milk production, hypothyroidism, breast trauma or injury, intraductal papilloma, duct ectasia, which are dilated milk ducts, certain medications, hormonal changes during menstruation, Paget's disease of the breast, periductal mastitis, which is inflammation around milk ducts, pregnancy and breastfeeding, prolactinoma, a pituitary tumor, and, excessive stimulation or pressure on the breasts. When to see a doctor? You should seek medical advice if you're still menstruating and the discharge doesn't stop after your next period, or if you're postmenopausal and notice spontaneous, clear or bloody discharge from one breast only. Important note: avoid touching or squeezing your nipples to check for discharge, as stimulation can trigger more discharge and make it worse. Even rubbing against clothing can sometimes cause fluid to leak.